I just have a few introductory slides to sort of set the stage today. So as a way of introduction, patients with FSH face a variety of challenges, both social and medical, in transitioning to adulthood. And I think that the FSH community can learn from considerable efforts by other medical communities regarding the needs of young people while they're transitioning and the resources available. That said, there are needed studies, working groups, literature on what the specific needs are for those with FSH and how to address them. So there is no literature currently on transition in FSH, and this is actually the first discussion group that I've been involved in with transition in FSH. So some of the challenges. Teens with FSH are asked to make major social transitions. So this is leaving high school, starting college or a job, moving out of the family home, and at the same time, medical transitions. They need to find physicians or care providers who treat adult muscular dystrophy. And this is occurring when their disease is often becoming more disabling. There's very little information and guidance for adolescents and their parents in transition. So, as I mentioned, many pediatric diseases are now confronting the issues of transition. Most notably, pediatric HIV has made some major inroads into how to help young people make the transition in their care. Also pediatric cystic fibrosis, and in the muscular dystrophies, the group that has really tackled this issue is Duchenne muscular dystrophy. So there are working group synopses and some literature available on these different medical conditions and communities, that some of which may be applicable to FSH, and I encourage us all to take a look at that for our own children, but also for the community. So the MDA has launched an effort in this regard. They have a website called the Transition Center. They've put together a handout which is both in English and in Spanish called Roadmaps to Independence for Parents and Guardians. And essentially this is a fill-in-the-blank type of worksheet or program to help think about various different issues and get organized. Parent Project Muscular Dystrophy has had two major meetings on the issue of transition, and has really looked at the social and psychological aspects of transition in addition to the medical. And most recently they had a pre-meeting associated with their annual conference, which was in Baltimore, the Connect conference. And this is a meeting in which about 300 or so families come and hear from investigators. And there will be a publication coming out on that. Another resource that I think is quite good is Toronto Hospital for Sick Kids. They have something called Good to Go Transition Program and Readiness Checklists. And they have a number of resources under that website. For instance, something to fill out and put in your wallet that says, you know, this is my condition, these are my physicians, these are my medications. One could put in there, for instance, no oxygenation without ventilation. It's a good resource. So in terms of Duchenne, some success factors have been identified from these working groups. The first was in Amsterdam, and that working group synopsis was published in Neuromuscular Disorders in 2012. And these success factors include social and physical support leads to independence. Setting goals and reaching them promotes a positive cycle. Acceptance, coping, and optimism are vital. Access to good medical and psychosocial information is vital. Continuity of medical care during transition to adulthood is vital. So many of these may seem, okay, well that's obvious. We've got to address the psychosocial aspects of our young person in order for them to be successful. But unless one has sort of a list of those things that have been identified as key success factors, then they don't necessarily address each one of them. And that's really going to be critical for each of our young people. So a theme that comes up very frequently in transition, and the young people in our clinic here have to make the transition to adulthood like everyone else. They have to make those social transitions. They don't have to make quite as many medical transitions because we don't kick them out at age 21. There are a lot of really good muscular dystrophy centers across the country which are limited in what age they can see, up to what age they can see children, or the particular neurologist or pulmonologist may stop seeing children at 21. But one needs to start early, regardless of the medical care. And transition is not a single process. It's not like, okay, boom, we're transitioned. You know, we're 18, we're in college now, we've successfully transitioned. It's a complex, time-consuming, and ongoing process that really does take years. And the recommendations of how early to start that vary by disease. I'm sure it really varies by child. But at a minimum, one needs to be starting to have these conversations 2 years at a minimum before you're expecting some major social or medical transitions. It's incredibly important to encourage the active participation of the young person with FSH. Of course, that's a transition that all parents make, of allowing their child to have more and more autonomy of their lives. And when you have a child with a chronic disorder, you may be more involved with your child and making those decisions, and giving up some of those decisions is difficult. Unfortunately, that's what we all have to do as parents, and to make a successful transition, a young person has to take ownership of the management of their disease. So this is going to require some very open conversations on issues that we don't like to talk about. As who's we, parents, our society. So sexuality, separation from parental care, bodily appearance, and you know that's an issue in FSH as much as any of the other muscular dystrophies, maybe even more so. Loss of physical function, and so to be able to discuss these issues with the young person openly, and to evaluate what his or her comfort level is with them, what his or her anxieties are, is extremely important. And then, of course, teaching skills for independence early is extremely important for every parent, in addition to parents of children with FSH. So what do we hope to get from that? Some of the expected or hoped for outcomes. The individual with FSH will make a successful transition to adulthood, and that would be marked by autonomy of his or her healthcare decisions. It would be marked by a team of healthcare providers who are well versed in FSH and can provide good interdisciplinary care. It really is marked by a healthy ego. So a person with FSH may be unhappy about one aspect of their body or one aspect of their life, but that isn't internalized into how they feel about themselves as a person. The successful transition is marked by social supports, not just within the family, but beyond the family, and that really becomes more crucial as we hope this person becomes more independent and is relying on a larger community than just the parents. And that the individual is either continuing in education or able to find employment. And that is a real challenge, particularly finding the employment depending on the degree of disability. And probably a subject for a whole another support group.